The nurse cares for a patient with a urinary tract infection, UTI. The patient has an allergy to penicillins. Which of the following medications is contraindicated for this patient's illness? A. Streptomycin. B. Clindamycin. C. Sulfasalazine. D. Ceftriaxone. E. Ciprofloxacin. The answer is D. Ceftriaxone. Patients with allergies to penicillins often have cross-allergies to cephalosporins. Cephalosporins such as ceftriaxone should be avoided by patients with these allergies. Patients with cephalosporin allergies should also avoid penicillins. Streptomycin, ciprofloxacin, clindamycin, and sulfasalazine may all treat UTIs but are not penicillins. The nurse assesses patient medications at a primary care clinic. Which of the following patients with osteoporosis should not be prescribed alendronate? A. A 70-year-old female with chronic kidney disease. B. A 62-year-old female on a low-calorie diet. C. A 65-year-old female who is allergic to iodine. D. A 58-year-old female taking estrogen. E. A 53-year-old female taking captopril. The answer is A. A 70-year-old female with chronic kidney disease. The nurse should identify alendronate as a medication that slows bone loss, and is commonly prescribed to patients with osteoporosis to maintain bone density. The nurse should assess ages and risk factors associated with both osteoporosis and alendronate use. Alendronate is contraindicated in patients who are allergic to it, have esophageal issues such as narrowing or blockages, are unable to sit or stand upright for 30 minutes after taking, or have kidney dysfunction or low blood calcium levels. Therefore, the nurse should question the order of alendronate for the 70-year-old female with chronic kidney disease. The nurse should also recognize that older patients are more likely to experience problems such as contraindications with medications due to polypharmacy, so the age of the 70-year-old female should concern the nurse. Alendronate is not contraindicated in patients who are on low-calorie diets, and it is not contraindicated with estrogen or captopril. The pediatric oncology nurse talks to relatives of a child with leukemia. The patient's uncle wants to donate blood for transfusion. Which of the following donor conditions would preclude him from donating blood? A. A 200 mg dose of ibuprofen 20 hours ago. B. A history of Crohn's disease in remission 3 years. C. A history of hepatitis C, 4 years ago. D. A previous cholecystectomy 2 years ago. E. A diagnosis of diverticulosis 10 years ago. The answer is C. A history of hepatitis C 4 years ago. Blood donors must be healthy and feeling well to donate blood. They must also be free of blood-borne pathogens such as HIV/AIDS and hepatitis B, C, and D. Diverticulosis, Crohn's disease, a previous cholecystectomy, and a dose of ibuprofen the previous day do not preclude this person from donating blood. The nurse reviews medication orders for a patient with acute gastritis. Which of the following medications is contraindicated for this patient? A. Ibuprofen. B. Propranolol. C. Furosemide. D. Calcium supplements. E. Acetaminophen. The answer is A. Ibuprofen. Patients with acute gastritis experience inflammation in the gastric mucosa. They must discontinue use of drugs that may cause gastritis or inflammation, such as NSAIDs like ibuprofen or alcohol consumptions. Calcium gluconate, furosemide, acetaminophen, and propranolol are not associated with acute gastritis and can be taken safely by this patient. Which of the following high tyramine foods should be avoided by individuals taking monoamine oxidase inhibitors, MOIs? A. Aged, smoked, fermented, or pickled foods, pork, chocolate. B. Pumpkin, sesame, and sunflower seeds, brassicas. C. Charred, toasted, or roasted foods, glazes, added sweeteners, and syrups. D. Leafy green vegetables, sweet potatoes, tomatoes. The answer is A. Aged, smoked, fermented, or pickled foods, pork, chocolate. Tyramine is an amino acid that is present in many foods, including fermented, aged, or smoked foods, aged cheese, fish, pork, cold cuts, chocolate, alcohol, yeasty breads, peanuts, and beans. High tyramine intake in patients on MOIs can cause hypertensive crisis due to monoamine oxidase's role in tyramine breakdown. Patients taking which of the following antibiotics should be cautioned against any alcohol consumption? A. Mupirocin. B. Neomycin. C. Penicillin. D. Metronidazole. The answer is D. Metronidazole. Drinking alcohol while taking metronidazole can result in nausea, vomiting, flushing, and tachycardia. This is due to metronidazol's inhibition of acetaldehyde dehydrogenase, the enzyme responsible for acetaldehyde catabolism. Reduced function of acetaldehyde dehydrogenase results in toxic levels of acetaldehyde in the blood. Monoamine oxidase inhibitors, MOIs, should not be combined with foods that contain large amounts of what monoamine? A. Synephrine. B. Tyramine. C. Histamine. D. Epinephrine. The answer is B. Tyramine. Tyramine is normally broken down by monoamine oxidase. Monoamine oxidase inhibitors prevent the breakdown and removal, leading abnormally high tyrosine levels in the body. This can in turn displace the storage and increase release of multiple other catecholamines, including dopamine, epinephrine, and norepinephrine. This increase in free catecholamines can cause a hypertensive crisis. You are the nurse taking care of a patient who is being discharged on warfarin for a pulmonary embolism. Which of the following statements would you most likely give when counseling the patient about warfarin use? A. You can participate in all physical activities, including contact sports, while taking warfarin. B. You have an increased risk of seizures while taking warfarin. C. Your risk of bleeding events is not significantly elevated while taking warfarin. D. Do not consume grapefruit juice when taking warfarin. E. You can discontinue taking aspirin, if you were already taking aspirin, while you are taking warfarin. The answer is D. Do not consume grapefruit juice when taking warfarin. This advice is correct because warfarin is metabolized and inactivated by the cytochrome P450, CYP450, enzyme complex, and grapefruit juice is an inhibitor of CYP450. Therefore, when grapefruit juice is consumed, the efficacy of an activation of drugs, like warfarin, is impaired, which increases the effective level of warfarin circulating in the patient's blood. Consequently, even if the patient is taking the prescribed dose of warfarin, the effect of the drug may be greater than intended if taken with grapefruit juice, which can predispose to dangerous, potentially fatal bleeding effects. Thus, avoiding grapefruit juice while taking warfarin is the most appropriate advice for this patient. The patient's risk of bleeding events is elevated while taking warfarin, even without consuming grapefruit juice, though the benefit of preventing future blood clots and pulmonary emboli outweighs the risk of bleeding. Due to the risk of bleeding events while taking warfarin, it would be inappropriate to advise the patient to continue participating in contact sports. Warfarin is not known to cause an increased risk of seizures. It would be inappropriate to advise a patient to discontinue taking aspirin while on warfarin unless explicitly instructed for a medical reason by his physician. While aspirin is an antiplatelet agent, which can predispose to bleeding, and warfarin is an anticoagulant, which also independently can predispose to bleeding, each medication has a clinical indication in the patient, and therefore it is inappropriate to simply discontinue one medication. You are counseling a new patient about initiating a combined oral contraceptive pill, OCP. You know that certain medications can affect the metabolism of OCPs. Which of the following medications could alter the metabolism of OCPs? A. Ciprofloxacin. B. Docusate. C. Lisinopril. D. Fluoxetine. E. Aspirin. The answer is A. Ciprofloxacin. This choice is correct because the combined oral contraceptive pill, OCP, is metabolized and inactivated by the cytochrome P450, CYP450, enzyme complex, and ciprofloxacin, a fluoroquinolone antibiotic, is an inhibitor of CYP450. Therefore, when ciprofloxacin is taken, the efficacy of an activation of drugs, like OCPs, is impaired, which increases the effective level of OCPs circulating in the patient's blood. Consequently, even if the patient is taking the prescribed dose of OCPs, the effect of the drug may be greater than intended if taken with ciprofloxacin or other drugs that inhibit CYP450, which can make the potential adverse effects of OCPs more likely to occur, or occur with greater severity than if that patient had not taken ciprofloxacin with it. Neither lisinopril, an ACE inhibitor, fluoxetine, an SSRI, docusate, a stool softener, nor aspirin, an anti-inflammatory, antiplatelet agent, appreciably induce or inhibit CYP450, and therefore none of them has an appreciable effect on OCP metabolism. You are the nurse taking care of a patient taking warfarin. Despite taking the prescribed dose regularly, the patient's international normalized ratio, INR, is persistently subtherapeutic. You ask the patient if they take any other medications. The patient is most likely to be taking which of the following medications? A. Cimetidine. B. Gemfibrozil. C. Erythromycin. D. Cnidin. E. St. John's wort. The answer is E. St. John's wort. Warfarin is metabolized by the CYP450 enzyme complex, which is known to be induced and inhibited by a variety of other common medications, supplements, and foods. Since this patient's international normalized ratio, INR, is subtherapeutic, meaning that warfarin is not achieving a great enough effect. This should raise the possibility of increased metabolism of warfarin by CYP450, which means that warfarin will be inactivated more quickly than usual. The only agent listed that is known to induce or activate CYP450, which would speed the inactivation of warfarin, is St. John's wort, an herb commonly used for antidepressant activity and anti-inflammatory activity. Gamfibrozil, quinidin, cimetidine, and erythromycin all are inhibitors of CYP450, not inducers, and therefore would slow the metabolism of warfarin, increasing the effective circulating dose of warfarin, which would raise the INR. Therefore, these are not correct answer choices for this case. You are the nurse taking care of a patient being treated with metronidazole for a lower gastrointestinal infection. Which of the following instructions should you give the patient? A. Do not eat spinach when taking this medication. B. Do not consume alcohol while taking this medication. C. Lie flat for 30 minutes after taking this medication. D. Do not take your cholesterol medication when taking this medication. E. Avoid operating heavy machinery while taking this medication. The answer is B. Do not consume alcohol while taking this medication. In this question, what is really being tested is your knowledge of side effects, interactions with metronidazole. One of the major interactions to be aware of with metronidazole is that it can cause an unpleasant interaction when consumed with alcohol that is very similar to the symptoms that occur when one consumes alcohol while taking the alcohol deterrent, antabuse. This reaction includes severe abdominal pain, cramping, nausea, vomiting, facial flushing, and headaches. Patients should avoid drinking alcohol while taking metronidazole and for 3 days after completing their course. Eating spinach, lying flat for 30 minutes after taking metronidazole, taking cholesterol medication while taking metronidazole, and operating heavy machinery while taking metronidazole are inappropriate recommendations, as there are no known direct associations between metronidazole and spinach consumption, head elevation, cholesterol medications, or level of consciousness. What is the most common vitamin deficiency seen in patients taking metformin? A. B6. B. K2. C. D. B12. The answer is D. B12. B12 deficiency is common in patients on metformin, and should be monitored and supplemented either sublingually or intramuscularly. A male client is receiving 150 mg of gentamicin every 8 hours for a soft tissue infection. The nurse giving this medication is aware there are several serious side effects associated with gentamicin, including ototoxicity. Which statement by the client indicates that he may be experiencing this serious side effect? A. I am feeling nauseous. B. I have a metallic taste in my mouth. C. There is a severe rash on my neck and chest. D. I have a high-pitched ringing sound in my ear. E. I am having difficulty swallowing. The answer is D. I have a high-pitched ringing sound in my ear. The ringing in the ear is tinnitus, which is indicative of ototoxicity. Nausea, metallic taste in mouth, difficulty swallowing and skin reactions are not associated with the development of ototoxicity. Which of the following is the most serious potential adverse effect of enalapril? A. Low blood pressure. B. Angioedema. C. Dry cough. D. Nausea and vomiting. The answer is B. Angioedema. All of these are potential side effects of ACE, angiotensin-converting enzyme, inhibitors such as enalapril, but angioedema, the swelling of the face, lips, and/or tongue, is a potentially life-threatening condition, as swelling can obstruct the airway. Which of the following is a symptom of digoxin toxicity? A. Rash. B. Mood swings. C. Tremor. D. Nausea, vomiting, and diarrhea. The answer is D. Nausea, vomiting, and diarrhea. Nausea, vomiting, and diarrhea are common symptoms of digoxin toxicity. Other symptoms may include confusion, anorexia, irregular heartbeat, and palpitations. Tremors, mood swings, and rash are not generally seen with digoxin toxicity. A 19-year-old client presents to the emergency department explaining that he has a history of sickle cell anemia. He is complaining of severe pain in his arms and legs. The nurse recognizes that the patient is experiencing a sickle cell crisis, and is going to administer pain medication as ordered. The nurse is aware that which of the following pain medications is contraindicated for this disorder? A. Morphine. B. Hydromorphone. C. Ibuprofen. D. Fentanyl. E. Mepridine. The answer is E. Mepridine. Mepridine is contraindicated because in high doses it can form a toxic metabolite that can lead to seizures. All other drugs listed are appropriate for pain control for sickle cell crisis. Which of the following best describes extrapyramidal side effects? A. Nausea and vomiting, diminished consciousness, disorientation. B. Altered color vision, altered taste sensation. C. Cutaneous flushing, hypertensive crisis, tachycardia, sweating. D. Dystonia, tremor, slurred speech, restlessness and anxiety. The answer is A. Dystonia, tremor, slurred speech, restlessness and anxiety. Extrapyramidal side effects generally present as slow or repetitive motions or postures, dystonia, spasm, tremor, slurred speech, slowed thought process, restlessness and anxiety, paranoia, and general overall distress. These effects are caused by antipsychotic drugs that act as dopamine D2 receptor antagonists. Which of the following drugs would be least likely to cause extrapyramidal side effects? A. Bupropion. B. Haloperidol. C. Alprazolam. M. D. Fluoxetine. The answer is C. Alprazolam. M. Extrapyramidal side effects are common with typical antipsychotic drugs that act as dopamine D2 receptor antagonists. These include many selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, and norepinephrine dopamine reuptake inhibitors, NDRIs, as well as antiemetics such as metclopramide. Alprazolam is a benzodiazepine and is not associated with extrapyramidal adverse effects. Which of the following medications is associated with increased risk of SIADH, syndrome of inappropriate antidiuretic hormone secretion. A. Drospirenone. B. Chloropropamide. C. Azapoxalone. D. Metronidazole. The answer is B. Chloropropamide. Chloropropamide, an antidiabetic medication in the sulfonylurea class, has been associated with drug-induced SIADH, syndrome of inappropriate antidiuretic hormone secretion. This is a rare but serious complication that will generally resolve once drug treatment has stopped. None of the other drugs listed are associated with this side effect. Which of the following medications can cause the benign side effect of causing an orange-red tint to urine and tears? A. Metronidazole. B. Clindamycin. C. Rifampicin. D. Vancomycin. The answer is C. Rifampicin. Of the drugs listed, the only one associated with this bizarre side effect is rifampicin, a broad-spectrum antibiotic used in tuberculosis. Urine, sweat, saliva, or tears may be turned any shade from red to reddish-orange. Which of the following antibiotics is potentially ototoxic and may cause irreversible hearing loss? A. Gentamicin. B. Penicillin. C. Doxycycline. D. Erythromycin. The answer is A. Gentamicin. Gentamicin is an aminoglycoside antibiotic. Most antibiotics in the aminoglycoside class can have significant ototoxic effects. Of these, streptomycin and gentamicin are primarily toxic to the vestibular system, while amikacin, neomycin, dihydrostreptomycin, and kanamycin primarily affect the cochlea. None of the other antibiotics listed are generally associated with ototoxicity. A 24-year-old female presents with a simple urinary tract infection, for which she is prescribed ciprofloxacin. What is the most severe potential side effect of this medication? A. Tendon injury or rupture, especially Achilles tendon. B. Kidney failure. C. Hepatotoxicity. D. Seizures. The answer is A. Tendon injury or rupture, especially Achilles tendon. Ciprofloxacin has been associated with several cases of tendon injury and rupture, with the typical rupture occurring in the Achilles tendon. Other less severe side effects can include nausea and vomiting, headache, insomnia, and increased sensitivity to caffeine. The other symptoms listed are not generally associated with ciprofloxacin use. Which of the following antibiotics is strictly contraindicated in pregnancy, in lactating mothers, or in children under 8 years old, due to risk of irreversible teeth staining? A. Tetracycline. B. Ceftazidime. C. Rifaximin. D. Clindamycin. The answer is A. Tetracycline. Tetracycline antibiotics are strictly contraindicated in pregnancy, in lactating mothers, or in children under 8 years old, due to risk of irreversible teeth staining. The discoloration occurs only in adult teeth that have not broken the gum line, so adults are not at risk. A 42-year-old man with a history of severe depression who is currently prescribed multiple antidepressants presents with tachycardia, hyperreflexia, sweating, mydriasis, myoclonus. He is confused and mildly agitated. On questioning, he admits that he may have taken one too many of one or more of his medications. What is the most likely cause of his symptoms? A. Hypertensive crisis. B. Serotonin syndrome. C. Extrapyramidal side effects. D. Tardive dyskinesia. The answer is B. Serotonin syndrome. The symptoms this patient are presenting with are consistent with serotonin syndrome, a rapid onset and potentially life-threatening condition of excess circulating serotonin. Symptoms can range from mild to severe, and may include tachycardia, nausea and vomiting, diarrhea, hyperreflexia, sweating, mydriasis, myoclonus, mental status changes, headache, and coma. Serotonin syndrome is generally caused by drug interaction or overdose of drugs that raise circulating serotonin levels, such as selective serotonin reuptake inhibitors, SSRIs, and monoamine oxidase inhibitors, MOIs. A 63-year-old female presents with involuntary grimacing, lip smacking, excessive blinking, and sticking out of the tongue. She also flicks her fingers and her wrists. She states that she has no control over these movements, and that they have gotten progressively worse over the last 3 years. Her family is worried that she may be experiencing an early form of dementia. Her medical history is significant for depression, for which she has been taking aripiprazole for the last 9 years. Which of the following is the most likely cause of her symptoms? A. Early onset Alzheimer's disease. B. Worsening depression. C. Tardive dyskinesia. D. Serotonin syndrome. The answer is C. Tardive dyskinesia. The most likely cause of uncontrollable muscle movements in the absence of other systemic symptoms in a patient with a history of antipsychotic drug use is tardive dyskinesia. This is a disorder of rapid involuntary movements, most often in the face or head but also potentially affecting the extremities. Its exact cause is not well understood, but it is theorized to be an issue of sensitization of the D2 dopamine receptors after long-term neuroleptic use. Which of the following is not a common side effects in individuals using selective serotonin reuptake inhibitors, SSRIs? A. Increased risk of bone fracture. B. Low libido. C. Increased risk of suicide in children and adolescents. D. Coronary heart disease. The answer is D. Coronary heart disease. While SSRIs have been known to cause a variety of adverse effects, including diminished libido, increased risk of suicide in children and adolescents, restlessness, photosensitivity, and increased risk of bone fracture, individuals taking SSRIs are not associated with any increased incidence of coronary heart disease. Which of the following over-the-counter medications has been associated with hepatotoxicity and liver failure? A. Cetirizine. B. Diphenhydramine. C. Acetaminophen. D. Acetyl salicylic acid. The answer is C. Acetaminophen. Acetaminophen has surpassed viral hepatitis as the most common cause of acute hepatic failure in the United States. Hepatotoxicity can occur in doses of 7.5 grams or up for adults and 150 milligrams per kg of body weight in children aged 1 to 6. None of the other drugs listed are particularly hepatotoxic. What is the mechanism of cytotoxicity in acetaminophen-related liver failure? A. Depletion of gliatothin. B. Blockage of bile canaliculi. C. Fibrosis of hepatocytes. D. Formation of fatty infiltrates. The answer is D. Depletion of glutathione. Acetaminophen depletes glutathione, one of the body's most important antioxidants. The liver is the body's main processing organ for environmental and ingested toxins, and glutathione is the primary molecule the liver uses to rid itself of the harmful byproducts of the detoxification process. When glutathione is severely depleted, such as with acetaminophen overdose, hepatic cells can rapidly necrose, resulting in liver failure and even death. An individual taking which of the following medications must be instructed to remain upright for a minimum of 30 minutes after ingestion in order to avoid esophagitis? A. Alendronate. B. Finasteride. C. Paclitaxel. D. Phalodipine. The answer is A. Alendronate. Alendronate is a bisphosphonate drug used in the treatment of osteoporosis and osteogenesis imperfecta. An individual taking this medication should be instructed to remain upright for a minimum of 30 minutes after ingestion in order to avoid esophagitis. Other gastrointestinal adverse effects of alendronate include esophageal strictures, achalasia, gastric ulcers, and gastritis. None of the other medications listed are associated with esophagitis. Which of the following is not a side effect associated with beta blockers? A. Dizziness. B. Fatigue. C. Weakness. D. All of these are side effects of beta blockers. The answer is D. All of these are side effects of beta blockers. The most common side effects of beta blockers are fatigue, dizziness, weakness, cold hands or feet, dry mouth, headache, nausea, diarrhea, and shortness of breath. Death by opiate overdose is generally the result of A. Respiratory depression. B. Myocardial infarction. C. Liver failure. D. Serotonin syndrome. The answer is A. Respiratory depression. The answer is A. Respiratory depression. Most opiates can cause respiratory depression when taken in toxic levels. They do this by reducing the sensitivity of respiratory center neurons to carbon dioxide, which results in decreased breathing. In more moderate cases, brain damage can precede death due to CNS hypoxia. Opiates generally are not associated with liver failure, unless taken as a combination drug with acetaminophen, such as hydrocodone, heart attack, or serotonin syndrome. A nurse is working with a 36-year-old patient comes in for a back injury after a motor vehicle accident. He is prescribed acetaminophen for pain relief. 3 days later he calls the nurse to complain that he is experiencing itching all over. He is concerned that he might be having an allergic reaction to the pain medication. There is no rash associated with his pruritus. He has no hives, no nausea or vomiting, no shortness of breath, no swelling of the mouth or face. What is the most likely cause of his itching? A. Opiate-triggered histamine release. B. Dermatitis due to opiate allergy. C. Kidney failure. D. All of these are likely causes. The answer is A. Opiate-triggered histamine release. Many opiates stimulate histamine release by mast cells. The cause of this stimulation remains unclear, but it is considered to be a non-immunological, therefore, not an allergy. There is some speculation that opiates trigger the release of histamine from mast cells by directly activating G proteins on mast cell surfaces. Opiates are not generally associated with kidney failure, and the most common symptoms in opiate allergy include hives, flushing, hives, low blood pressure, gastrointestinal discomfort, though constipation is typical in most patients and does not indicate allergic reaction, and angioedema. Which of the following is a common side effect of nonsteroidal anti-inflammatory, NSAID, use? A. Weight gain. B. Gastritis. C. Hypertension. D. Muscle spasms. The answer is B. Gastritis. NSAIDs are frequently associated with irritation of the gastric mucosa. This can lead to gastritis, ulcer formation, gastric bleeding, or perforation. NSAID use is not generally associated with weight gain, loss of bone density, muscle spasms, or hypertension. You are assessing a 23-year-old female who presents for follow-up after being started on oral iron sulfate 1 month ago for iron deficiency anemia. In the last month she was also started on azithromycin for a respiratory infection, and has been taking ibuprofen for back pain. She now complains of 3 weeks of constipation. She tells you that her diet consists of many green, leafy vegetables, red meat, and greasy, fatty foods. Which of the following is the most likely cause of her constipation? A. Ibuprofen. B. Green, leafy vegetable consumption. C. Azithromycin. D. Iron sulfate. The answer is D. Iron sulfate. The most likely cause of this patient's constipation is the oral iron sulfate that she is taking. Constipation is a very common side effect of oral iron therapy, and for that reason, iron therapy is often given concurrently with a stool softener to relieve constipation. The other medications taken, azithromycin, and ibuprofen, each commonly cause some degree of gastrointestinal upset, including but not limited to abdominal pain and diarrhea, but not constipation. Dietarily, the consumption of green, leafy vegetables is associated with looser, more regular bowel movements, as opposed to constipation. The consumption of greasy, fatty foods is also associated with looser bowel movements, rather than constipation, making it unlikely that her diet is the cause of her constipation. You are the nurse taking care of a patient with a history of schizophrenia, not on any medications, who is being admitted for disorganized thoughts, paranoid delusions, auditory hallucinations, and combative behavior. The physician orders a dose of haloperidol to be administered. Prior to giving the haloperidol, you suggest that which of the following be done? A. Obtain a CT abdomen. B. Obtain a blood glucose level. C. Obtain a chest X-ray. D. Obtain an electrocardiogram, ECG. E. Contact the authorities to detain the patient since he or she is being combative. The answer is D. Obtain an electrocardiogram, ECG. Haloperidol has the potential to prolong the QT interval on an ECG. QT prolongation can be particularly dangerous in patients who already have a prolonged QT interval due to a pre-existing medical condition, for example long QT syndrome, or medications they are already taking. A prolonged QT interval has the potential to progress on ECG to more dangerous arrhythmias including torsades de pointes and ventricular fibrillation or tachycardia, which can be fatal. Therefore, it is imperative to check a patient's QT interval on an ECG prior to administering haloperidol to confirm that they do not already have a prolonged QT interval. While this patient's blood glucose is not necessarily going to be normal, that is not something that needs to be emergently checked prior to haloperidol administration. There is no indication to obtain a chest X-ray or CT abdomen prior to haloperidol administration. It would be inappropriate to contact the authorities to detain this acutely psychotic patient with schizophrenia, as the patient is already in the hospital and in the care of a psychiatric medical team. Further, even though the patient is combative, if necessary, the medical team is allowed to place the patient in restraints without the need for police intervention. There is no evidence that any members of the care team are in acute danger. A physician orders Viagra, sildenafil, for a patient to treat erectile dysfunction. The patient currently takes fish oil, nitrates for chest pain, prednisone for lupus, and aspirin and simvastatin for vascular disease. Sildenafil is contraindicated in this patient because he takes which medication? A. Aspirin. B. Fish oil. C. Simvastatin. D. Prednisone. E. Nitrates. The answer is E. Nitrates. Sildenafil is contraindicated in a patient who is already taking nitrates because nitrates alone can cause a decrease in the patient's blood pressure, and sildenafil can also independently cause a decrease in the patient's blood pressure. When taken together, sildenafil and nitrates can cause a potentially very serious drop in the patient's blood pressure that can cause headache, dizziness, weakness, syncope, and any further consequences of those symptoms. Thus, whenever sildenafil is being considered for a patient, their current medication list should be closely evaluated for any other medications that may decrease their blood pressure. Neither fish oil, simvastatin, prednisone, nor aspirin are known to decrease blood pressure and therefore would not be contraindications for administering sildenafil to this patient. You are the nurse taking care of a patient who takes multivitamins, pravastatin, verapamil, warfarin, and prednisone daily, as well as sildenafil as needed for erectile dysfunction. He complains of headaches and dizziness when he takes the sildenafil. What is the most likely reason for these complaints? A. The combined action of sildenafil and prednisone. B. The combined action of sildenafil and pravastatin. C. The combined action of verapamil and sildenafil. D. The combined actions of prednisone and warfarin. E. Side effects of warfarin. The answer is C. The combined action of verapamil and sildenafil. In this patient, he complains of headaches and dizziness that are brought on by taking sildenafil, an erectile dysfunction medication. Common side effects of sildenafil include headaches and lightheadedness, as sildenafil can decrease systemic blood pressure since it is a vasodilator. The risk of experiencing these side effects from sildenafil is increased in patients who take other medications that can decrease blood pressure. Of the other medications that this patient takes, verapamil, a calcium channel blocker, is the most likely medication that is known to decrease blood pressure. The combined actions of sildenafil and verapamil, both to decrease blood pressure, best explain the headaches and dizziness that this patient experiences when taking sildenafil in addition to his daily verapamil. None of the other choices are correct, as the only choice that contained two medications that each individually would decrease blood pressure to explain the patient's symptoms was the choice containing verapamil and sildenafil. You are counseling a patient about the possible side effects of his new blood pressure medication, lisinopril, which is an ACE inhibitor. Which of the following statements would be most appropriate to make when counseling the patient? A. Lisinopril frequently causes blindness as a side effect. B. Lisinopril is associated with an elevated risk of renal cell carcinoma. C. Lisinopril is associated with an elevated risk of myocardial infarction. D. Lisinopril is associated with an elevated risk of stroke. E. You may experience a barky cough when taking lisinopril. The answer is E. You may experience a barky cough when taking lisinopril. This question tests your knowledge of the side effect profile of lisinopril. A very common side effect associated with lisinopril use is a barky cough. Lisinopril, an ACE inhibitor, has an additional effect of inhibiting the degradation of bradykinin, therefore raising circulating levels of bradykinin. Elevated levels of bradykinin result in bronchoconstriction, which can cause the dry, barky cough that some patients taking lisinopril experience. Other side effects of lisinopril include but are not limited to hypotension, headache, dizziness, and syncope. Lisinopril is not known to cause an elevated risk of renal cell carcinoma, myocardial infarction, stroke, or blindness. You are the nurse taking care of a patient in a dermatology practice. The patient is prescribed minocycline, a tetracycline antibiotic, for acne vulgaris. When counseling the patient about the side effects of minocycline, you advise the patient which of the following statements? A. Avoid prolonged sun exposure while taking minocycline. B. Severe headaches can be safely ignored while using minocycline. C. Do not drink apple juice while taking minocycline. D. You should not wear sunblock when outdoors while using minocycline. E. You cannot take acetaminophen while using minocycline. The answer is A. Avoid prolonged sun exposure while taking minocycline. This question tests your knowledge of a common side effect of the tetracycline antibiotic, minocycline. Minocycline is known to cause phototoxicity as a side effect in some patients, which may increase the risk and/or severity of sunburn in patients taking the medication. As such, patients should be counseled to avoid prolonged sun exposure when taking minocycline, and if they must be exposed to the sun for significant periods of time, to wear sunblock and keep their skin covered as much as possible. Other side effects of minocycline include upset stomach, diarrhea, tooth discoloration in young children, and rarely, pseudotumor cerebri, severe headache and visual disturbance due to intracranial hypertension. As such, it would be inappropriate to advise a patient to ignore severe headaches while taking minocycline. Apple juice and acetaminophen are not contraindicated in patients taking minocycline. You are taking care of a patient who requires gentamicin, an aminoglycoside antibiotic, for a complicated urinary tract infection. Which of the following would you be most concerned with when assessing the patient during his gentamicin course? A. Visual acuity. B. Liver function tests. C. Hearing and renal function. D. Hot or cold sensitivity. E. Hair loss. The answer is C. Hearing and renal function. This question tests your knowledge of the significant potential side effects of the aminoglycoside antibiotic, gentamicin. Gentamicin, like most aminoglycosides, carries a risk of ototoxicity and nephrotoxicity. As such, it is very important to assess a patient's hearing function regularly while taking gentamicin, and to follow the patient's BUN or creatinine, to monitor their renal function while taking gentamicin. In addition, gentamicin dosing is often decided upon via close collaboration with the inpatient pharmacist as they take into account the patient's current dosage and the effect that it has had on the patient's renal function to date. Gentamicin is not known to significantly influence liver function, hair loss, visual acuity, or hot or cold sensitivity, and therefore these would not be the most important considerations when assessing a patient who is taking gentamicin. You are the nurse taking care of a patient with intractable back pain. You are about to administer a dose of oxycodone and are describing possible side effects to the patient. Which of the following common side effects should you warn the patient about? A. Constipation. B. Blindness. C. Headache. D. Tinnitus. E. Serotonin syndrome. The answer is A. Constipation. Constipation is a very common side effect associated with use of opioid medications, such as oxycodone, especially in patients who have not been frequently treated with opioids in the past. As such, Patients are often advised ahead of time about the possibility this side effect and may be started concurrently on stool softeners and colonic motility agents, such as senna and ardocusate. Blindness, tinnitus, ringing in the ears, headache, and serotonin syndrome all are not known to be associated with use of opioid medications, like oxycodone. You are the nurse taking care of a patient with severe hip pain that is unresponsive to acetaminophen and NSAIDs. You are prepare a dose of hydromorphone and describe potential side effects to the patient. Which of the following side effects should you warn the patient about? A. Foot pain. B. Pruritus. C. Diarrhea. D. Pharyngitis. E. Hair loss. The answer is B. Pruritus. Pruritus, or itching, is a fairly common side effect of opioid medication use, and hydromorphone, also known as Dilaudid, is a potent opioid. As such, patients should be advised of this potential side effect prior to initiation of therapy, and should be advised to inform the nursing or medical care team if they experience pruritus, as dosing can be adjusted, and/or additional medications may be added to control the itchiness. Neither hair loss, foot pain, pharyngitis, nor diarrhea are side effects known to be associated with opioid use. The answer is E. Diarrhea. Diarrhea is a common side effect associated with antibiotic use, including cefalexin. This diarrhea is typically self-limited and resolves within the first day or two of administration. Sometimes patients are advised to take a probiotic or consume yogurt when starting a new antibiotic if they experienced diarrhea when starting antibiotics in the past. Neither headaches, hair loss, pharyngitis, nor necrotizing skin rash are known common side effects of cefalexin use. You are the nurse in a primary care clinic taking care of a 26-year-old female with a urinary tract infection. You are counseling her about taking her antibiotic, cefalexin. You warn her that a common side effect is which of the following? A. Pharyngitis. B. Headache. C. Hair loss. D. Necrotizing skin rash. E. Diarrhea. The answer is E. Pregnancy. Patients initiating isotretinoin therapy should all be strictly advised to avoid becoming pregnant, and must absolutely not be started on isotretinoin therapy if they are actively pregnant. Isotretinoin is a potent teratogenic agent, and could cause devastating effects to a developing fetus, including but not limited to termination of the pregnancy. Even one dose of isotretinoin can cause major birth defects of the baby's ears, eyes, face, skull, heart, and brain. Any female patient who is going to start isotretinoin therapy must be tested for pregnancy immediately prior to therapy and repeatedly throughout treatment. Make sure you use 2 specific forms of birth control and have regular pregnancy tests while taking this medication. There is no known significant interaction between isotretinoin and NSAID use. Likewise, there is no reason why a patient on isotretinoin must avoid bananas, grains, or juices. You are the nurse in a dermatology clinic taking care of a 22-year-old female with severe nodular acne. She is going to start isotretinoin therapy after this appointment. She should be strictly advised to avoid which of the following? A. Eating grain products. B. Taking NSAIDs. C. Drinking juices. D. Eating bananas. E. Pregnancy. The answer is D. Edema. All of these are possible side effects of calcium channel blockers, but the most common side effect is edema. Calcium channel blockers decrease blood pressure by hindering the influx of calcium into myocardial cells. They may also increase the diameter of blood vessels, which always results in decreased blood pressure. Which of the following is the most common adverse effect of calcium channel blockers? A. AV block. B. Gynecomastia. C. Nausea. D. Edema. The answer is D. Hypertension. Hydrochlorothiazide is a thiazide diuretic, used primarily in the treatment of hypertension and edema. Which of the following conditions can be treated with hydrochlorothiazide? A. Pericarditis. B. Angina. C. Atherosclerosis. D. Hypertension. The answer is B. Angiotensin receptor blocker, ARB. Losartan is an angiotensin receptor blocker, ARB. This class of drugs lowers blood pressure by blocking the conversion of angiotensin 1 to angiotensin 2 and is useful for patients who cannot tolerate ACE, angiotensin converting enzyme, inhibitors' adverse effects. What class of drug is losartan? A. Loop diuretic. B. Angiotensin receptor blocker, ARB. C. Angiotensin converting enzyme inhibitor, a CE inhibitor. D. Calcium channel blocker. The answer is D. Calcium channel blocker. Diltiazem is an example of a calcium channel blocker. This class of drugs reduces blood pressure by relaxing smooth muscles in the walls of arteries, leading to vasodilation and decreased peripheral resistance. Diltiazem is an example of what class of cardiovascular medication? A. Angiotensin receptor blocker. B. Beta blocker. C. Potassium-sparing diuretic. D. Calcium channel blocker. The answer is C. Block response to beta-adrenergic stimulation. Beta blockers act by blocking response to beta-adrenergic stimulation. In that way they are beta-adrenergic antagonists, rather than agonists. ACE, angiotensin-converting enzyme, inhibitors, not beta blockers, block the production of angiotensin II, but both act to decrease blood pressure. Beta blockers have nothing to do with beta cells of the pancreatic islets, which secrete insulin. Which of the following describes the mechanism of action of the class of drugs known as beta blockers? A. Beta-2 adrenergic agonists. B. Block the production of angiotensin II. C. Block response to beta-adrenergic stimulation. D. Block beta cell secretion in the pancreas. The answer is C. Beta blockers cannot be stopped abruptly due to risk of severe, even fatal, rebound hypertension. The most critical safety information a patient must know when initiating beta blocker therapy is that they cannot abruptly stop taking their beta blocker, due to the risk of rebound hypertension. A beta blocker would be more likely to cause bradycardia and a depressed effect than anxiety and tachycardia. Beta blockers are not associated with any type of esophagitis and they are not fat-soluble, thus it is not crucial to eat a fatty meal with the drug in order to improve absorption. When educating a patient on a new beta blocker prescription, which of the following safety information is most critical? A. Beta blockers should be eaten with a meal that contains fat to improve absorption. B. Beta blockers may cause anxiety and tachycardia. C. Beta blockers cannot be stopped abruptly due to risk of severe, even fatal, rebound hypertension. D. The patient must stay upright for at least 30 minutes after taking a beta blocker due to risk of esophagitis.